Hi, I'm Darren from Quay Health. Today we're going to be talking a little bit about neck and headaches. Okay, you might think they are different, but they're definitely connected, as you can physically see. On my last post on my Facebook page, which is Darren Geer, Acupuncturist at Facebook, I talked about texting and your neck and problems that you could have with it. So to talk more about the neck, please introduce Marti Harris, the owner of Quay Health.
Hi everyone. Hi Darren.
Hi, there you go.
You might be wondering why I've got a bowling ball in front of us.
I am wondering that.
Okay, well, all will be revealed today. Imagine, everyone, that this is someone's head. There's kind of a similarity between the two, really.
Mine's a cue ball.
But the weight of our head, when we're texting, Darren, would pull our body forward. Do you think that would hurt our necks?
Eventually, yes.
How about you try?
Yeah.
Hold that up as your head. Okay. Now, comfortable, isn't it? Relatively.
It's comfortable when I'm sitting like this. Yes.
Posture.
Posture's right.
Absolutely. So your posture when you're texting certainly has a contributing factor to the amount of tension that your neck has to carry. So, if you're bringing that ball back to close to being in an upright position, this would be probably better.
Yes.
Yeah?
Absolutely.
So here there's less load on the structures of the neck. Let's take a closer look at that. So down here we've got the human skull and the neck. So you can see these things down the side. Here are the nerves, here are the joints. These allow us to move our neck properly, and they also support weight. Most of the weight comes through the discs and also by the muscles that support the neck. Okay? So looking after your neck makes perfect sense, doesn't it?
Absolutely.
Headaches come from irritation to those nerves, affecting those joints and those discs. If you carry that bowling ball, we're carrying around that, you don't have to pick it up, it's okay. But if you're carrying that around all day, looking at text and even using the thumb to dial away and keep up to speed with everything that's going on in the world, that causes unnecessary stress and strain.
Absolutely.
These muscles up here are tiny, so their function is to guide movement, not support weight. And so if they have to support weight, Darren, they're going to have to be tense. And that triggers headaches. That's one of the things that triggers headaches. There's other causes of headaches, obviously. 10 to 15% of the population experience headaches on a regular basis. Do you know that seeing a chiropractor and an acupuncturist can certainly find the solution for that problem?
Absolutely.
So how, understanding chiropractic and posture, that's an easy understand. How about acupuncture? I'm here just interested in knowing more about that.
Okay, well, acupuncture, definitely we have a way of looking at this, but also there's one other lifestyle factor that most people don't consider, and that is working at the computer. A lot of people work at the computer, and because we deal with a lot of corporate people here, obviously they're on computers. They sit in a particular way where they're supposed to sit like this. Everything is supposed to be ergonomically correct, but what happens is, as the day goes forward or the stress builds, they start rolling their shoulders forward and then putting this undue strain on the neck, on the muscles.
Absolutely.
And a lot of people actually think that my neck is tight. It's actually not tight. It's actually the muscles in this section here, right up to the back of the occiput, are starting to elongate. So this is starting to tilt forward, stretching the muscles and causing pain in this area. Now, this also combines with the tightness of the chest. So the chest becomes tight, everything becomes tight, and they get this hunched forward look. You see a lot of people around here, a lot of kids, a lot of teenagers actually, mostly from texting and working on computers all the time. They have that kind of problem. And then what that does in the traditional Chinese medicine sense is it opens up this area here. This is then causes pain. Pain can then cause weakness. Weakness then can cause sickness. So it's a multi-level sort of thing. But with Chinese medicine and acupuncture, we actually look at the body in a very holistic sort of way. So we'll check the energy of the person. So we will look at how much circulation is going through this part of the head. Normally when the people have the computer or texting problems or holding a bowling ball, the pain goes right up through this area here, which is known as the bladder meridian. The bladder meridian is what they refer to as the defensive meridian to cold and flu. Okay? Well, some people would call it that, other people may not. We're not here for an academic talk. But here we are. So this is one of the areas that you will get a headache. Other areas of the head that you may experience headaches are down the sides, from the trapezium up into the occiput here as well. So down the side of the neck, and that usually does come from stress. Mm-hmm. Stress, a lot of stress, and that also can be felt right up in the temporal region up here. So yeah, and then what we have to do as an acupuncturist is look at why that is happening. Then in our basic theory, we clear the meridians,
right.
Open them up,
right.
Make things more pliable, more flexible, and that's what relieves the pain.
So what I do, when people have that headache problem, it can come from a number of different causes. What I do is identify where that problem's coming from, and I'm going to relieve that stress and strain on that area by helping to align those structures. And that can be done using your hands or using instruments, whichever is most suitable for the person, their age and so on, taking into consideration any deterioration that may be going on as well. So we'll put this guy away.
Yeah. But that's also one of the things that is really good about working with a chiropractor and an acupuncturist together. You can pop things back in structurally, and I'll just open up everything, loosen the muscles, and then you get an overall better sense of pain relief.
Definitely. We get great results alone, but we get even better results when we work together.
Absolutely.
That's what's happening in healthcare these days, is people are coming together and finding solutions for people that involve a more holistic view. So if that sounds like something that you want to do, then please contact us. Visit us at Quay Health. Make the call today.
See you then.
Bye-bye.